Alrighty, so like always, you'll just knock on the door, introduce yourself, use hand sanitizer, explain to the patient that you'll be doing a cardiovascular exam, just get permission. And then you'll want to go ahead and start off with just having the proper exposure, so make sure your patient has their shirt off. And then we'll start with looking at the precordial. So when we're inspecting, we want to look for any gross deformities, which there are none. Nipples are aligned. There's no caving into the chest, and there's no pulsations, so that's all good. And then from there, we'll want to go to palpation. So then we'll want to come here. You just sit more upright for me. We'll go right here. We'll come here, and we'll come in the second intercostal space, right sternal border in the aortic region. And we want to palpate for lifts, and then we also want to palpate for thrills. Alrighty, and we'll come over here in the second intercostal space, left sternal border, and the pulmonic one. We'll want to assess for lifts and thrills. We'll come down, third intercostal space, palpate for lifts, thrills, and then fourth intercostal space, palpate for lifts, and then thrills, and we'll come down here in the fifth intercostal space, midclavicular line, assess for lifts, and then thrills. Alrighty, and then while we're down here, we can also assess for the point of maximal impulse. So we'll go ahead in the same region, fifth intercostal space, midclavicular line, and we'll use the whole hand. Alrighty, and that can be felt, and that is strong pulse. It's about less than 2.5 centimeters. Alrighty, and that is good with that. So that finishes up palpation, so then we'll go to auscultation. So while the patient is sitting, we'll assess in all the regions of them sitting up, but we'll only listen with the diaphragm. So we'll do all the same regions we did before, and just make sure that you sanitize the stethoscope before using on the patient. So come down here. Second intercostal space, right sternal border. Alrighty. Second intercostal space, left sternal border. Third intercostal space, left sternal border. Fourth intercostal space. And then fifth intercostal space, midclavicular line. Alrighty, and then I'll have you go ahead and take a deep breath in, take a deep breath out, and as soon as you take a deep breath out, lean forward, and I'm going to have you hold your breath for me for a few seconds. Alrighty. And then that finishes up with the patient sitting up, so then we'll have them lay down. So I'll kind of move this out of the way. And again, we'll auscultate in all the same regions, but this time we'll want to make sure we use the diaphragm and the bell. Feeling okay?
Yep.
Alright. So come here. that was the diaphragm bell. All right. Alrighty, and with the bell. Third intercostal space. The bell. Alright. Fourth intercostal space. Bell. Fifth intercostal space, midclavicular line, diaphragm. Fit with the bell. Alrighty. And then I'll have you come over to this side, and then you can go over and fill on that side. I'm gonna have you lay on your left side, and we'll assess that fifth intercostal space in the left lateral decubitus position. So I'll have you kind of just lift up your arm. Yeah, there we go. Come down here again, find that position. Alrighty. Diaphragm. Alrighty, and the bell, and that finishes up auscultation of that. And with that, there's no indications of murmurs, gallops, or rubs, and there's clear S1 to S2 sounds. So then you can go ahead and sit back up for me. And now we'll assess the carotids. So I'll come over here, I'll assess your left carotid first. We'll palpate. Alright, and then we'll do left. Or right, sorry. Alrighty, and these pulses are strong and symmetrical, and so then we'll go ahead and we'll auscultate those. Make sure I found it first. There it is. Alright. Do the same on this side. Alright, there it is. I'm gonna have you hold your breath for me, actually. Sorry, I forgot to say that. It makes it a little bit easier on my part. There we go. Alrighty, so upon auscultation, carotids are brisk with no bruise. So that finishes that, and then the final part of the assessment will go on to feeling the pulses. So we'll start here at your hand. We'll feel for your radial pulse. So come right here. Like that. We'll do it bilaterally on each side. Alrighty, and we'll come up here, we'll do brachial. Let me know if I'm pressing too hard relax your arm for me a little bit. There you go. Alrighty. Come over here. It might be hard to film, but let's see. Rest your arm for me. Yep. And there we go with that. So then covers those. So then I'll have you lay back down for me again. And we'll just film this. Ideally, you'd have the patient lower their shorts or pants, but for purposes, we'll keep those on. But I'll just show the femoral would be right here. You want to feel for those. And these are deeper, but it's going to be harder to feel. So these aren't really palpable right now through the shorts. Alrighty. And then we'll come over here and we'll do popliteal. So I'll have you bend your knee for me. Yeah, it doesn't matter. We'll start on this one. I'll kind of have to like brace your knee like that for me. Kind of, you have to dig for these ones. Is that hurting you?
No.
Try one more time. Okay, there we go. That one, we'll do it on this leg. There it goes. Feel it there. We have 2 more pulses. We'll come down here. We'll do posterior tibial. It's right here on the medial malleolus. There we go. Those ones are pretty easy to feel on you. And then we'll come up here and we'll do the dorsal pedis. There we go. Let me do it on this side. There we go, that one's a good one. Alrighty, and that'll finish up that exam. You can go ahead and sit up. Pulses are strong, symmetrical, no abnormalities noted. I'd say there are 2+ with regular rhythm. And then that would finish the exam.